Hi, my name is Jody Morris. This is the week 2 video discussion on informed consent. The mental health professionals should always review their professional disclosure statement with their clients. This document would include information on the counselor's qualifications, their therapeutic approach, any fees, any late fees, etc., privacy and the client's rights, a discussion surrounding all of these areas, and any questions the client has about the process of care should be covered at this time. And then both parties would get a signed PDS document. The PDS is important to establish it's important to establish for a standard of professionalism and care for our profession. It gives the client information that they need prior to deciding to enter a counseling relationship with the therapist. In Section A2 of our 2014 American Counseling Association Code of Ethics, it describes informed consent as covering the rights and responsibilities of the counselor and the client. There are a few significant differences between informed consent and a telepath informed consent. Telehealth. One being possible issues surrounding privacy. Both parties must ensure their own privacy, which includes not recording sessions unless there's written consent by both the therapist and the client they've both given the written consent. It should also be communicated if any issues arise with the technology, what the backup plan might be. Telehealth informed consent may have specific regulations from state to state that should be researched before taking on each client. Signing a telehealth informed consent form helps in compliance with professional guidelines, state laws, and insurance requirements, which can be beneficial for both the client and the therapist. The requirements of informed consent are client information, therapist information, the nature of the services, confidentiality, any fees, payment policies, supervision and credentials, limitations, dispute resolution, ethical and legal considerations. The therapist may consider adding things to the informed consent form, including their personal way of doing things, like having regular check-ins just to make sure the client's getting what they need from therapy. If they would like to discuss any other things, as it is their responsibility to bring up any current issues that may need to be discussed as they arise. I'm looking forward to hearing your responses.